Yeah, our support has primarily focused on providing help with guideline and guidance documents development, as well as doing rapid reviews, in particular in the context of the COVID-19 pandemic, where we've done rapid reviews on social distancing, the use of masks, and related topics. The other big area of interest has been to help with a more recent effort of revising the WHO guideline development handbook. We have created, together with many international institutions and organizations, including PAHO, a recommendation map that categorizes and catalogs all recommendations from guidelines that relate to the COVID-19 pandemic. That is one of our major contributions. It's called the eCOVID Rec Map. And the big learnings from that initiative are that guidelines are often developed with some sufficient methodological rigor, but in many instances, it is difficult to understand whether or not appropriate rigor was applied. These guidelines are not WHO-specific guidelines, although they're included. These are guidelines that are produced by any organization globally that we are critically appraising and have made publicly available for any user. Our experience in being a collaborating center is overall, I would say, very positive. It has allowed us to work with colleagues globally and connect also with other collaborating centers that work either in similar or related fields. The benefits certainly are that we feel we are informed what is of interest in global public health and global health, and that we understand the priorities, have access to colleagues at the World Health Organization. The challenges are, like in most research settings, some collaborating centers are research settings, are related to funding and sufficient financial support to keep activities going. And I think another challenge is what is the benefit for an institution like McMaster University, and relating this benefit to decision makers at the university level, but maybe also at the provincial level, to then do receive the appropriate support. Well, I will provide a biased view on that, obviously. I think it's a very positive assessment, and the impact has been very positive. For instance, through the work that I just cited about our recommendation mapping that not only has taken place for COVID-19 questions, but also, for instance, with the global TB program, where we have mapped all tuberculosis recommendations and have now put out scientific publications as well as practical work that supports member countries in implementing WHO guidance. So those are some very, I think, some very concrete advantages and positive outcomes. The other thing is that I do believe that we've been able to bring many different organizations together, not only our academics working in the collaborating center and, for instance, PAHO, or the essential medicine list group that we work with centrally in Geneva, but also organizations like the Guidelines International Network, like NICE, and so on, in the initiatives that we've pursued.